guys. So today I'm going to be doing the deep shoulder back massage that I promised you last time. Just a heads up, you're going to basically do what we did in the last neck massage video and then do what I'm about to do now. It's really important that you are checking with your client about the pressure. You're making sure that you're only doing these sorts of moves on somebody that wants deep pressure. Also, even if they are the type of person, and a lot of people will just want you to dig in there really deep right away because they're in pain, you're going to want to warm up the tissue because you could injure somebody, especially somebody who already has an injury, which is why they're hurting. So warming up the tissue, bringing a little bit of blood flow to the area, making sure that everything's loosened up as much as possible before getting in deep is really important, even if it feels like it's tedious and it's going to take a lot more time. You just don't want to make any more issues for somebody as you're trying to help them. So just a reminder, you will have warmed up the whole spine and neck, done a little head rub. And then the parts of the body that you can really get in deep, starting at the top, it's going to be these little points in here at the base of the neck. So you're finding the base of your skull, starting where it reaches with your spine, following those little points through there. And you can put deep pressure, but if you're going to do that, again, you want to be standing, you want to have your body in alignment, you want to be trying to get the pressure as much from your body, from your legs really, as possible. And this is more true for somebody smaller like me, and it matters a lot the size of the person that you're working on too, not just the pressure that they want. Because you could work on somebody who's bigger than you that wants light pressure. You're still going to want to be careful about your body mechanics. So with these, once you find a spot that you want to get in deep, you want to kind of have a straight hand and a straight forearm. So again, you're using strength from higher up in your body rather than right from your hand and your wrist, because then you're going to hurt yourself. And then you're going to go deep and then pull out, and then deep and then ease up. And sometimes it'll be for a few seconds. Sometimes it'll be for less. And you can do that on the other side as well, going all along the base of the skull. And then even down underneath that ridge, especially along the spine, is going to be really helpful. Adding in some of that massage effleurage. And then working your way down to the neck. It's going to be the 2 points that I pointed out last time in the video. It's the kind of top of the shoulder blade where it meets the trapezius. And the most people are going to have a little knot there. Some people might be tender. Some people are going to want you to get in there really, really deep. That's going to be true for anybody who wants a deep tissue massage. They almost always want deep tissue right through here. Even if a lot of their issues are lower body, because our heads are so heavy, they're usually leaning a little bit forward as we go about our day. These muscles back here get overstrained and overworked, compensating for that weight. So there are a lot of times you can just dig in really deep, and you're going to want to use your whole body for this. The idea is not just that you're using your shoulder, because you're going to hurt your own rotator cuff that way. You want to use your whole body, basically just get this in a position with your shoulder, your front open, your shoulder open, and in alignment with your neck. And then all of that is in alignment with your spine so that you're putting pressure from your hips. And you want to have them in a chair that's going to be stable for this, obviously, because you're going to be putting pressure through there. And you can count and then ease off. You can ease in, count for a few seconds, and then ease off. And you can keep doing that until you either feel a release or the client is happy with how that feels. Same thing on this side. You want to have your body in alignment. You want to be in kind of a crouch position, working from your legs, working from your core, not overstraining your shoulders. So you're going to get in here like this, right at that knot point here. The other parts of the body that a lot of people can use a lot of deep pressure, and you're going to be careful with this. This is only after you've checked in with your client about any rotator cuff issues that they have, any injuries that they have, if they have regular headaches. All of this you're going to want to be a little bit more careful. But if they have tension through here and they don't have any injuries related to that, and I'm going to turn this a little bit so you can see my whole body as I'm doing this. Because I'm actually in a crouch position here, and I'm using my whole body to lean in, holding her hand, her palm out. I'm leaning in under that shoulder blade, and I'm using my whole body coming from the legs. I'm not using my arm, I'm not using my wrist, I'm not using my fingers or my thumb, because you're just going to hurt yourself that way. And holding on to her so that I have an idea of where that shoulder blade's going to be, and it's not going to move around on me while I'm putting this sort of pressure. Again, being really careful for the client's safety as you do this sort of work. I say client, I'm thinking it's probably going to be your relatives or the people you're quarantined with, your partner. So then the last points that you could do a lot of pressure on are down here. And what these are is your SI joint. It's your sacroiliac joint, which means it's where your hip bones and your spine are really coming together. Your sacrum really is the bottom of your spine. So it's down here. And you can use the base of your hand to get some good circular motion and get some good pressure. Again, you will have warmed this all up. So you can go in there a little bit deeper with the base of your hand, being really careful about your wrist. You don't want to bend it too much. You want to have it as straight as possible. And then if it feels like they can take even more pressure, you can use that elbow again. Using a straight back for you and using your whole body. A lot of it is having to do with your body weight. And in my case, a lot of legs, because I oftentimes am working on people who are bigger than me and my body weight isn't going to do it. So for really deep pressure, I'm using my legs as much as possible and trying to get my upper body in alignment so that it won't hurt when I'm done. Obviously, these are tips from a professional who will do this for hours on end. The trick for people who are doing it at home with their partners or their family members is that you won't be used to this. So you can also injure yourself. So that's part of why I keep reminding you to be careful with your own body. So that's the video for today. Hope it's helpful. Give me any feedback if you want to. This is going to be posted on my webpage, the NC Massage. So I hope you're all doing well. Talk to you soon.